Going to begin. Welcome to session 9 of the Washington Healthcare Facilities Initiative webinar series. My name is Joanne McGriff, and I'm the Associate Director of the Center for Global Safe Water, Sanitation, and Hygiene at Emory University, also known as the CGSW, as well as Assistant Research Professor in the Department of Global Health at the Rollins School of Public Health. Today, we are happy to have with us colleagues from PATH and Zero Mass Water, who will be talking about WASH technologies for healthcare facilities. I am joined by members of our learning team today, Ms. Lindsay Denny and Cassandra Savino. As you all may know, this series is part of an action-oriented learning platform that seeks to connect, share, and act. We work to connect the expertise and experience of our partners and colleagues to the WASH and health community members who are interested in moving to action in WASH and healthcare facilities. We also provide a platform for the community of practice to share experiences, ideas, and best practices. And we also encourage individuals and groups to take specific action to implement sustainable interventions that improve WASH conditions in healthcare facilities. So as usual, I invite the meeting attendees to start introducing yourselves by locating your chat box, going to the drop-down and selecting all attendees. Please make sure you select that because otherwise only the panelists get your chat box comments. So select all attendees and then type in your name and organization in the chat box as I review some quick notes about the structure of this platform. So this is just a reminder that each month we highlight WASH in healthcare facility subject matter experts in about 25-minute presentations, followed by about 30 minutes of facilitated discussion. Today, we will have 3 presenters. We will have a brief overview of technologies by Lindsay Denny, and then we'll turn to our special guests from PATH and Zero Mass Water, who will each present for about 12 minutes, and then we'll move to discussion for about 25 minutes. For reference, please be reminded that you and your colleagues have access to webinar recordings, slides, learning materials, summaries, and action documents through our website, wnhcfaction.org. Please also know that you can send us emails with questions or feedback at wnhcfaction@emory.edu. We're also on Twitter, so please consider following us on our handle at wnhcfaction. I'll now pass it on to Lindsay Denny. We'll provide a few additional reminders as well as recent WASH and healthcare facility updates. After the announcements, Lindsay will continue with the overview comments before I return to introduce the speakers. Lindsay?
Great, thank you so much, Joanne, and great to speak to you all from Geneva. I'm at the World Health Assembly, and hopefully I've found a quiet enough spot to be able to speak to you all clearly. So before we get started, I want to summarize the guiding principles that are how we align our speakers and our topics every month. So there are 4 principles, the first of which we believe that WASH is a fundamental prerequisite for quality care within a healthcare facility. Secondly, there cannot be effective infection prevention and control without adequate WASH in healthcare facilities. Thirdly, sustainability should be built into every healthcare facility project from the very beginning, no matter the project size. And lastly, WASH in healthcare facilities is not just about addressing issues at individual facilities. Multiple systems, sectors, and stakeholders must work together to see sustainable improvements. A quick note about Zoom for those of you who are new to the webinar. Please feel free to use the chat box at any time to introduce yourself, ask questions, or make comments during the presentation or the active discussion at the end. And as Joanne noted, please choose all panelists and attendees. Secondly, if during the discussion you'd like to raise your hand to have a question, select the raise hand button, only if you have option to use a speaker on your computer or phone. If we select you, we'll let you know, and then we will unlock your microphone from our end. So circling back to some of the more the content around this webinar, I wanted to give a bit of background around why we are here. So a reminder that SDG 3, Health and Wellbeing, and SDG 6, Water and Sanitation, both require WASH in healthcare facilities in order to be achieved. And last year, the UN Secretary General Antonio Guterres used the launch of the Water Action Decade to make a call to action on WASH in healthcare facilities, which in return has led to a resolution on WASH in healthcare facilities that I'll speak to in a moment. We've so far done 8 webinars plus a French session in the past 8 or 9 months, including health systems, assessments, hand washing in a healthcare facility, looking at the clean clinics approach, research on neonatal sepsis, costing, a toolkit for cleaners, and looking at national action in Tanzania. If you are interested in seeing any of those, they are recorded, as are the summary documents available on our website, WNHCFaction.org, WNHCFaction.org. So quick news and updates. We are currently at the World Health Assembly, and member states will be voting on Friday or Saturday on a resolution around Washington healthcare facilities. This resolution links Washington healthcare facilities to other major health priorities like universal health coverage, quality of care, and antimicrobial resistance. It also urges member states to take action in the form of assessment, action planning, and budgeting. And when I finish up here, I can share the link to that resolution so you can all take a look. It's a really great way to get member states to demonstrate their commitment to this issue and to get support from ministries of health around the world. So finally, before we pass off to our speakers for the day, I did want to quickly touch on technologies and hardware in the healthcare facility. So broadly speaking, we break down Washington healthcare facilities into 2 general categories in terms of interventions. There are infrastructure interventions and there are software interventions. Today we're focusing primarily on the hardware interventions. However, we know that it's not possible to succeed in hardware unless if you do not have software as well, such as training of staff, monitoring systems, etc. However, today's primary focus will be on hardware. And hardware could look like for water, access, storage, distribution, treatment, lots of different types of interventions. Specifically thinking about what technologies are needed to elevate Washington healthcare facilities and to accelerate progress and access. So to quickly think about a couple of ideas, there are water technologies. So the most prominent that we think about is water treatment. We know that clean water is needed in healthcare facilities, and many facilities do not have that kind of access. So you might see, as we see on the left, this is a type of filter that you might use for drinking water. You might have a point of use filter that's on a specific sink, or you might have some kind of water treatment that is centralized, as shown on the right here. There are also hygiene technologies. So you can have hand washing stations, for example, on the left here, maybe chlorine generation, here showing antennas water. And then also there are other technologies that perhaps don't yet exist yet. This is a photo from a healthcare facility in Ethiopia where they were hanging up a bottle to use, alcohol hand rub. As you can see, this is maybe not the most advanced, but are there other ways in which we could be getting alcohol hand rub to healthcare workers as needed? And finally, sanitation and healthcare waste management. I haven't heard of many sanitation technologies. Perhaps that's because they're not needed, and perhaps that's because not enough innovation has been around the sanitation piece, particularly given the major gaps that we find in the JMP numbers. And then looking at healthcare waste management, we see things like incinerators. Those have become fairly standard, but going from limited or no access to basic access in healthcare waste management may require further infrastructure. So Joanne, I'm going to hand it back to you to introduce our speakers.
Great, thank you so much, Lindsay. So again, welcome to session 9, entitled WASH Technologies for Healthcare Settings. Our guest presenters are Adam Drolet. He's a program officer from PATH, who has worked with the global team of innovators on the Sanitation, a chlorine generator for low resource settings. We will also hear from Colin Goddard, who is the US Director, and Joanna Egan, who is a Director of Business Development and Sales for North America, from Zero Mass Water, which is a startup that has developed solar-powered hydro panels. Without any more delay, I will welcome Adam Drolet to begin the presentation. Adam?
Great, thanks. Let me see. Okay, everyone see the screen and hear me?
Yes, we can see it.
Great. Well, thank you, Joanne, Lindsay, and Cassandra for this opportunity. I'm delighted to be here and to be talking about WASH technologies for healthcare settings. Having attended many of these webinars in the past, it seems like it's a bit higher stakes being on this side of the presenter versus the attendee, but again, thanks for this opportunity. So again, I'm Adam Drolet. I'm a program officer at PATH within our medical devices and health technologies team. And today I'll be talking about our work and specifically wash technologies for healthcare settings. So for those of you who are unfamiliar to PATH, we are a global organization of about 1,500 individuals working over 70 countries on public health issues. Our work spans generally 5 platforms that include vaccine development, drug development, diagnostics, devices and technologies, and health systems. And we take a multidisciplinary approach to our work, which I think sets PATH as a bit unique, combining expertise on the technology side, for example, product and mechanical engineers, market or commercialization folks with marketing background, and public health expertise. And so that trifecta really is aimed to identify both technology, but also systems and market requirements and public health needs to advance technologies for global health. At our core, we believe that better health moves humanity forward. And we see our work as reducing health inequities through technology, market, and systems innovation. Our work spans the value chain. So you can see from this graphic, and we support everything from incubating and supporting very conceptual, high-level ideas at the research and development stage, taking disruptive technologies, products, and services through the middle of the value chain, and supporting large-scale either refinements or introductions of product and systems innovation. How do we this? Well, we take a user-centered design approach and always putting the user at the forefront. And really where this starts is understanding what is the public health issue, that evaluation stage. From there, concepts, whether they're novel ideas, whether they're off-the-shelf solutions that can be retrofitted for new use settings, are considered and tested, and results are then inform if additional refinements are needed, or if we need to revisit whether the solution is really addressing the core key problem. This process occurs iteratively over and over and over with all of our work. So to give you a case study on what this actually looks like in practice, today I'll be talking about this MSR Sanitation Chlorine Generator. And so over the past several years, PATH and MSR have been working together. MSR is a private sector manufacturer based out of Seattle, Washington, to develop and advance an on-site chlorine generator that's user-focused, user design, and can address the key gaps in terms of chlorine access and availability within healthcare facilities. The device, as you see here, produces a 1% chlorine solution using salt, water, and electricity for infection prevention control and water treatment. And I think one of the unique aspects of this device, well, there are a couple, but the things that I want to call out are, one, it's a continuous flow device, which is different than batch-based systems. And I can get more into the details on if there are questions about that. And the second, this is now a connected device. So a lot of the data that's captured, technical performance data, is stored by the device and they'd be able to send to a cloud, which has been really helpful for monitoring and providing maintenance to the device. And finally, the device is specifically designed for healthcare settings. So again, thinking back to PATH's approach to public health problems, what problem are we solving? We know that healthcare-acquired infections are the most adverse event in healthcare delivery. Those infections lead to preventative morbidity and mortality outcomes, as well as a significant health burden, a financial burden as well worldwide. In fact, 1 in 6 patients in low-income countries will acquire a healthcare-acquired infection during their hospital visit. That's a staggering number. We know that chlorine is widely used. It's an effective chemical disinfectant recommended for infection prevention control. However, despite its proven effectiveness, the lack of consistent access and availability limits healthcare staff from providing safe and hygienic environments. And so recent data from Ryan Cronk and Jamie Bartram was able to show that an estimated 36% of healthcare facilities lack disinfection solution. So that's the key gap. Why is this the case? Well, primarily revolves around two key issues: supply and budget and cost. On the supply side, we know that healthcare facilities generally receive insufficient supply, which lead to stockouts or rationing, and for several reasons. One, there's limited supply budgets within facilities, or challenges with different income streams, whether they're from patient payments, insurance payments, that then don't fill up coffers for those healthcare facilities to be able to pay for medical supplies. So in other words, they can't order enough. Oftentimes the supplier has a low inventory or stock. So even if a healthcare facility submits an order for a certain quantity, they get a portion of that, which is finally delivered. So now they don't receive their full order. And finally, their transportation and logistics and cost challenges, whether it's the rainy season, whether it's the high cost of chlorine, that increase the delay and challenges in getting that full amount of chlorine to those healthcare facilities. So they just can't get the volume that's needed. One of the things that we're learning in this space too is there's significant challenges and problems around chlorine quality, ensuring that the concentration really is listed. The concentration really is what is listed on the outside of the bottle. So to put this in perspective, and again, thinking about the user in mind, bear with me while I read this quote. So current supply budget is not sufficient for the necessary volume of patients. We rely on patients to bring in their own chlorine. We know it's substandard, but it's better than nothing. So that's the context, that's the problem, that's the reality of what we're working with. So to address that, PATH and MSR set out to advance a technology that would produce chlorine on site, address that availability and supply chain issue, use low-cost inputs, not require specific reagents that would have to, again, rely on supply chains, be designed with the user and the context in mind, and produce a verified and easy to dilute concentration, that 1% diluting down to 0.5, which is typical for IPC. And start to think about, with the advent and increase in digital technologies and connected devices, how can we begin to use digital health and digital data for the betterment of WASH and washing healthcare facilities. So the Safi station, again, produces chlorine on site. It uses salt water and electricity. It's able to transmit data, and it produces that 1%. So how did we get here? Again, going back to that evolution slide that I talked about, we've gone through 5 different iterations across 50 prototypes in 8 countries. We've done years worth of testing, continuing to refine, again, with the user in mind. The most recent study that which we just wrapped up is a validation study in Ghana and Uganda in 24 healthcare facilities that span from healthcare centers up to regional referral hospitals. We used a mixed method baseline inline comparative design and really focused on 3 objectives: validating the performance, validating the acceptability, and determining what kind of cost impact, cost savings and would result from this device, and what kind of impact does the Safi station have on supply, chlorine supply for that facility. And so what we learned, I should say results are forthcoming. They should be coming in a couple of weeks. But to give you all a sneak peek, the remote data transmission was incredibly helpful for monitoring data and maintenance. We were able to have our engineers in Seattle, I'm located on the east coast of the US, be able to monitor, as well as our country teams in Ghana and Uganda, watch how the devices were performing and be able to share that data. And based on the errors that we were getting on its performance, be able to quickly triage and address any challenges that popped up. On the acceptability side, we saw rates ranging from 75 to 95% of healthcare staff viewing the device as moderately or very acceptable, with 95% of respondents saying that they would prefer the Safi station over current chlorine processes. On the availability side, we saw an increase in 500% in terms of chlorine volume available healthcare facilities in Uganda. And half of healthcare facilities in Ghana and 3/4 in Uganda saw anywhere from a 21 to 87% cost savings in the cost of chlorine supply. So again, thinking from the user's perspective and putting this in context, chlorine availability, high costs, and challenges in the supply chain, those are the challenges that healthcare facilities are facing. The Sanitation has the potential to improve the delivery of healthcare services. And as stated by this device user, since the machine was installed, there have been no stockouts. When the device was brought, there was no GEEC or chlorine in stock. So it has an immediate and profound impact. In terms of our next steps, we are, because of this, the results, positive results from this validation testing, we're interested in supporting MSR, increase the market, introduce the product into select markets in East and West Africa, as well as pushing the product category as a whole in order to increase chlorine availability in low and middle income countries. Path is product agnostic. We know that a single solution is not a silver bullet. And like Lindsay said, it's a mix of hardware and software. And so in some cases, there may be other solutions that are more appropriate. But again, it's pushing that product category, thinking about how can infection prevention control practices be improved with technologies and materials being a core component of that. The second area that we're looking forward to is to better understand how to integrate Sanitation and other chlorine technologies into health systems and capture the impact of those, that introduction and the use of those devices and technologies. So creating a better link between infection prevention control, wash services, and reduction in healthcare acquired infections, or nosocomial infections, reductions in sepsis rates. Last but not least, we would love to think big, think broader. What are other wash technologies in healthcare facilities that we can apply the same process to, understand what the gaps are, go through that iterative process of putting the user first and developing solutions. And the underlying theme under all these three areas is to share, share, share. So everything that we produce, we want to get out in the open, make sure that it's available for folks, and continue building on progress that both partners are making, as well as any contributions that we can make ourselves. So again, coming back to the users, coming back to who the main problem, as stated by a doctor in a Ugandan hospital, without chlorine, we can't function. Thank you very much.
Great, thank you, Adam Jolet from PATH for your presentation. We'll now move to Colin Goddard from Zero Mass Water.
Right. Great, can everyone hear me and see my screen?
Yes, we can.
Fantastic. Thanks so much again for this opportunity. My name is Colin Goddard. I'm a director of the U.S. market for Zero Mass Water, based in Washington, D.C. As Adam previously outlined, kind of a component of the larger problem the whole world is facing with access to clean water and wash. This slide kind of highlights a high level picture of the challenges in a different way. That there have been massive strides with wash activities that have increased access to clean potable water, yet there are still roughly 750 million people lacking access today. And if you project the growth into the future and you look at things like the recharge rate for underground aquifers, the intrusion of salt water into these freshwater sources, there's going to be a growing kind of water supply and demand gap over the next 10, 15 years that needs to be addressed. And overlaid on top of all this is the aging existing infrastructure that's been put into the ground that's piping water around to different users that, at least in the US, for example, was built nearly 100 years ago. And as that infrastructure ages, we are very much aware of a variety of health implications that has on the quality of water and on people who drink it as a result. So really big global problem, which is what we try to understand how we could make an impact with a new type of technology. And at our company, Zero Mass Water, we have a vision of perfecting water for every person in every place, and really carrying out that vision through a mission of helping make drinking water, what you put inside your body, what you cook with, an unlimited resource, and go from a kind of paradigm of scarcity to one of abundance. And the way that we have done that is through a very innovative, entirely new category of water technology, which we call a hydro panel, or in this case, what we call a source hydro panel. What you see here is the generation F of our source hydro panel that uses nothing but the power of the sun to make, mineralize, store, and dispense drinking water using by harvesting vapor in the air. This is an entirely solar powered unit, so there is no electrical or water inputs. This is entirely off grid, completely infrastructure free, and completely self powered. So this is really a clever combination of some advanced material science, thermodynamics, and controls technology that allows us to create water in this way. And we are able to be operational and generate water across a broad variety of ambient temperatures and humidity, even getting into very, very low and dry environments. Our company is headquartered in Scottsdale, Arizona, in the middle of the Sonoran Desert, one of the driest places in the entire US. And our panels there make water every day, and that's where we have engineered this technology from the beginning to be operational in those environments, which has helped our company expand since. On a high level of how it works, a traditional solar PV panel powers fans that pulls in air inside the hydro panel. And then that air passes over special hydroscopic materials which absorbs the water vapor that's in the air. Then a solar thermal panel heats that air to a high temperature, raising the dew point internally and creating a temperature differential over that special material, which essentially distills the water vapor and condenses it into liquid water. Then when those panels are deployed doing this in the field, they have their own internal machine learning algorithms to understand their environmental conditions of that specific location to tune internal processes to optimize and increase the amount of water that can be generated. And then as that water is condensing and collecting internally in an internal 30-liter or 8-gallon storage reservoir within each hydro panel, it's at that point we add calcium and magnesium to improve the pH balance of the water, to raise it to about a 7.6, improve the mineral content of the water. That water is then constantly recirculated and is ozonated with an onboard ozone generator to ensure that that water that is being stored there stays clean, and then it gets dispensed and passes through an activated carbon filter before being consumed. And again, all of these internal processes are entirely powered by the sun. And we really consider this a truly renewable water source, which is, again, so this is not a technology that treats or cleans dirty water. This is creating new pure water from the beginning. So there's really, unlike other ground or surface water sources, there's really no way to start with a contaminated product in that same way, and then it is the quality of that water is increased with calcium and magnesium that is added. So with this type of technology, we're able to really eliminate that extensive supply chain that exists between water that's in the ground or on the surface, and that's ultimately consumed through the network of pipes, distribution centers, plastic packaging, etc. I mean, this literally takes the air that's around you and pulls the water out for you to drink right there. I mean, it's a matter of a few feet. And very simple, very efficient delivery. Again, using entirely renewable power, and all of the components, everything that the water touches is all entirely food grade materials. And since we have a global operations base, we have created our own kind of global superset of international of contaminants that we are test against, and exceed every single category that's for tested. So we Again, I mentioned we use the onboard ozone generator to monitor the real-time sterilization of the water. And when we install a unit somewhere, we do a water quality test at the end of the installation to ensure that, as the system is closed and contained, that the installation was done correctly and the water is good to drink. So a brief overview of our operational footprint today. We have projects in 5 countries and roughly 5 continents and 24 countries around the world, roughly 252 different projects locations. That's everything from, 2 panels on a residential home somewhere to an entire field of hundreds of panels that I'll talk about later. And these applications are in a broad variety of climates, from the desert scenarios that I talked about, where we're headquartered in the Sonoran Desert, to equatorial jungles and downtown urban locations. No matter where the location is or the quality of the air, we're still able to make the same quality of water in all of these locations. Here's a high-level overview of some of the partners that we've worked with to date. I mean, some of our first projects were as a USAID subcontractor for an orphanage and elderly community center along the Syrian and Lebanese border. We have done projects with the Australian Renewable Energy Agency and a number of Australian local governments. It's a country that is hyper aware of water scarcity and the ongoing significant drought conditions. We recently joined a part of the Caribbean Climate Smart Accelerator, looking to help establish resilient infrastructure across the Caribbean. And actually, that was one of our first true healthcare facility projects. So that's just a high-level overview of some of the partners and NGOs that we've worked with in the past. And our work is really focused on helping solve really broad categories of 4 different challenges. One, if there's an entirely just simple lack of water infrastructure at that location at all, there's no pipe, there's unable to drill a borehole or a well, and that site is requiring constant transportation and trucking of water, we're able to be that on-site source of water generation. I mean, essentially think about it, instead of having to drill a hole into the ground to get your water, you're able to now tap into the largest untapped reserve of clean water in the air all around us. In other places, that are struggling to maintain water quality and have a variety of either naturally occurring of elements or human introduced elements, we're able to be that entirely separate source of water generation and supply, independent of all that existing infrastructure, to ensure that high quality water is being dispensed to those who need it. Cost savings, again, those folks who are having to truck water in or rely on bottled water supply, this type of technology can massively reduce the kind of financial costs associated with maintaining that supply chain. But also, this should also be warranted in terms of the cost savings, in terms of the environmental impact that all that single-use plastic has on the environment, or the greenhouse gas emissions associated with trucking and transporting water from place to place. And finally, resiliency. As I mentioned, in the Caribbean, with the changing climate conditions, it's more important now than ever to be able to have systems that are able to withstand shocks, are able to operate if the electric grid goes down, if water treatment centers are flooded and overrun, that our hydro panels are able to be that resilient on-site source of water generation to ensure that water is being made and stored and dispensed at all times of the day. Even though, going back earlier, we are entirely reliant on solar power, we do have an onboard lithium-ion battery that allows the water to be accessed 24 hours a day. And so how do these projects manifest? What are the kind of the bigger segments that we're looking at? And the first I would start with, similar to solar farms of big fields of solar panels to create massive amounts of electricity, we're now building our first water farms, or fields of hundreds or thousands of hydro panels that are able to scale to meet the demand of whatever application it is, whether that's a bottling line, whether that is a all supplying all the drinking water for a building or a hotel or something like that. And these are similar. These are similar in the structure of solar farms, in that they mirror the kind of power purchase agreement kind of financing model, in that these installations, you don't buy the panels themselves in kind of a large capex cost. This is where we install the panels at no cost, and the end users agree to buy all the water that the systems generate over a contracted period of time to make it of an operating cost. So this kind of financial flexibility allows different types of users access to the water that these systems generate without having to massively invest in a high capital cost. We do, though, however, do a large number of projects, not as big as a whole field of hydro panels, but between 2 and 100 panels on top of a building or next to a school. These are the traditional capex sales, where the panels are purchased and all the water the systems generate over a period of time is distributed for free. We have roughly, I think now close to over 50 local installation and servicing partners, allowing us to have a very localized presence and having inventory locally, and to train local staff on doing the very simple annual filter changes that are necessary, allowing us to have a large reach to sustain projects and build projects all around the world. And then, anyone today can go on our website and purchase 2 panels for their home. We have a direct-to-consumer line as well, as it's a commercially off-the-shelf technology that allows people to mount these panels up on their roof or put them in their backyard and plumb them to a new fountain in their house, or a faucet on their sink, or even in the back of the refrigerator, depending on their preference. And so, to date, most of our applications have been for kind of communities and homes and in the non-healthcare space. And so here's a picture on the left of a school in India. It's one of our early projects that has hydro panels mounted on the roof and to a dispenser inside for all the students to drink. On the right is a project with the Asian Development Bank on the island of Vanuatu that had their rainwater harvesting infrastructure decimated by Cyclone Pam roughly in 2015. So the rainwater there also was contaminated by sulfur due to volcanic activity nearby that made it very difficult to drink that water. So we partnered with the Asian Development Bank to put a larger array there, and public water fountain, so to speak, you see on the bottom of the picture, to allow people to come up and fill up and bring their water back home or drink it on site as needed. So that's been most of our applications. However, we recently did our first application and installation at the University of the West Indies hospital in the pediatric wards. On the left, you see actually that is our project there at the University Hospital of the West Indies in Jamaica. This is a hospital that was struggling to maintain a reliable access to clean water for patients to drink. They were having to purchase large quantities of bottled water. And, as Jamaica, like many of the Caribbean countries, are making many strides in reducing the number of single-use plastics. And so that put, a kind of particular strain on the operations of that hospital. And so in partnership with the Caribbean Climate Smart Accelerator, we installed panels on the roof and plumbed them to new dispensers that we mounted in various parts of the ward, allowing doctors, nurses, patients, and families to drink the water there renewably that's generated from the sun and the air all around the hospital. We also in the works of a project in Zimbabwe at a birthing center in a rural community outside of an urban area that also has actually has really no infrastructure at all to supply that birthing center with clean water. And so we have partnered with a local nonprofit there that operates the birthing center to install a field of hydro panels to supply water to the women who come and the patients who come. And actually the plan there is actually to increase the size of that array to make that several hundred panels and set up a local women-owned water bottling business to be able to bottle and sell the water that's generated on that site into the more affluent urban areas, and then use those funds to help purchase supplies for the birthing center. So this is a really creative kind of dual use project that we're trying to set up to create a model that is able to sustain financial resources for that birthing center years into the future. And finally, we just recently signed a partnership with a local clean energy firm in Haiti, who is very keen on having us speak with their contacts that operate a lot of small clinics distributed around the island. And so we'll be taking our trip there in the next few weeks to have those discussions and understand, how are ways that we can help those kind of smaller distributed clinics with a supply of on-site source of clean water. So that is a high-level overview of our company to date and our new forays into healthcare facilities. And thank you so much for this opportunity, and look forward to the comments and discussions in the future. Thank you.
Great, thank you. Colin Goddard from Zero Mass Water, and previously we had Adam Jolet from PATH. We also have Joanna Egan online from Zero Mass Water, but thank you to all of you for sharing details about your innovative solutions for water supply and treatment in healthcare facilities. Before we open the floor for questions, I wanted to quickly ask our attendees, I know there are over about 28 or 29 of you online, if you would please share with us whether you have technologies that you've been using in healthcare facilities that we have not mentioned. As you recall from the overview that Lindsay provided, we're interested in hearing from this community about other water, sanitation, or hygiene solutions that are being used sustainably in healthcare settings. So please, if you will, just select all attendees in your chat box and let us know about any other technologies that you may be using. And following that, I will now open up the floor also for questions for PATH and Adam and the Chlorine generator, as well as to Zero Mass Water, Colin and Joanna. So if you have not already, please again go to your chat box, select the all attendees and panelists, or don't forget to use the raise your hand function on the Zoom menu, and we will be able to unmute you. So please keep your hand raised so that we can see you and will allow you to speak. Also remember, if we don't get to your chat box question or to your hand today, we will do our best to work with Adam, Colin, and Joanna to respond to as many questions as possible that we will post on our website after the webinar. So just to start off, I have one question for Adam. Given your experience bringing the Chlorine generator from concept to market, what would you do differently if you had to go back?
That's a great question. There are a couple things. I think understanding of the healthcare system and IPC process and roles and responsibilities a bit more would, I think it would behoove us for the purpose of really understanding more of how to integrate technologies, where the kind of pain points are from not just the ability to provide infection prevention control practices, but for the incentives, the desires, the needs, the wants from those actually providing those services. So a good example is through kind of inadvertently, through this validation study, we learned that the trust in the 1% solution that the Southeast Asian Chlorine is producing was huge. And the issue that was addressing was much of the chlorine that's coming from different markets, from different suppliers, has either been sitting on the shelf for a while, so its concentration is in question. There's different reactions that people are seeing to off-the-shelf chlorine, to when you, for example, when you apply it to blood spills or whatever it might be. And so there's just a bit of doubt from providers, and that itself creates this sense of uncertainty and has a psychological toll on providers and whether they're providing the best care possible for their patients. So those very small details flipped around by focusing on ensuring and really talking about that chlorine concentration as it's verified, and we provided tests to users so they could test the chlorine solution every day and build that confidence. Those small little tweaks and understandings really create incentive and buy-in, and again, from that user's perspective, increase the potential for adoption of that technology. So it's a long way of saying understanding the kind of system drivers, user drivers for adoption of technologies in general, but in this case, infection prevention control technologies and the chlorine generator would have been, something I think is something we will in the next iteration really focus on understanding as part of the landscape and problem analysis.
Great, thank you so much, Adam. We have a question from Mira Bakatan from UNICEF Philippines, and this is for Colin or Joanna. There's a couple of questions, so I'll break them up a bit. So how big is each source panel? And maybe connect to that, what is the cost of producing 8 gallons of water?
Sure. So this is Joanna from Zero Mass Water. So in terms of the size, each panel is 4 feet by 8 feet. And the production value, so over the life of the panel, it's a 15-year technology, and it ends up being about 15 cents per liter is the cost. So that is kind of the overall there. And then I see the other questions that you have here pertaining to production. So the maintenance for the panel is very low maintenance. So the only thing that we recommend is annually you switch out the air filter, comparable to that of like an AC unit. It's a very easy switch and it's a low cost. And then every 5 years, we recommend you switch out the mineral cartridge. So that is, to your point there, it's readily replaceable. In local markets, we have installation and distribution partners globally. We have about 50 distributors now. And then when we set up a project, we will empower the local group with training and make sure that we have those parts readily available in the local market. And then on top of that, your final question here. So in terms of the water itself, when it is produced, it is pure water from the start. And because it is so pure, to your question, it can be a little bit acidic to the taste. So we then take it through a mineralization process. So we add magnesium and calcium. So it's kind of optimal for taste and health as well. So that is the portion of that mineral cartridge that I was speaking to there.
Great. Thank you so much. And there were multiple parts of that question, so thank you for addressing all of them, Joanna. I am going to move also from Mira. I think this was for Adam. Can you use a regular chlorine bleach product in the machine? Also, what is the cost of the machine and the cost of operating and maintaining it?
Yeah, great questions. So the device uses salt, regular table salt, and water, and that's mixed together and poured into the machine. And then the start button is pushed, and the machine itself converts that salt and water into sodium hypochlorite. So it breaks the Na and Cl down and H2O down and recombines those molecules to create sodium hypochlorite and hydrogen gas. So it's really, that's one of the advantages of on-site chlorinators in general, including the SAPI station, is they can use those widely available inputs as a way to overcome supply chain gaps of chlorine products, pre-prepared chlorine products. In terms of costs, MSR is interested in exploring, currently valuing the device at about $1,500 US, so US dollars, 1,500. And again, I think where that number comes into play is really understanding what does that mean over the expected lifetime, which is 5 years, run at 8 hours per day, 7 days per week. And what does that look like in terms of the cost paid for chlorine supply in healthcare facilities currently. And again, if you missed just a couple of data points from the study in Ghana and Uganda, we are seeing a cost savings from a majority, half if not a majority of facilities that are currently purchasing sodium hypochlorite off of from local suppliers, whether it's government suppliers or off the shelf. In terms of the operating and maintenance costs, the maintenance process is quite limited. It's running 30 milliliters of diluted vinegar solution through the device. We tested what that would look like once a month, but in reality, that cleaning process would likely happen much less frequently. And that cleaning process is strictly to ensure the longevity of the device by cleaning the internal plates, make sure that they don't get caked with the sodium, the salt that's being run through the device. We don't have quite the numbers on the operational costs, but we know again from the material inputs plus the device what that compares to the supply costs, chlorine supply costs that healthcare facilities are currently receiving. I hope that answers your question to some degree.
Great, thank you, Adam. We have another question for Colin and Joanna, and I presume it is for Zero Mass Water team. This is from Nurula Awal, and there's actually 3 questions. So what is the production capacity per hour of the panels? Can the panels isolate arsenic? And then the third question, do you recommend the panels for water scarcity regions with salinity?
This is Colin. Those are great questions. Roughly, the production depends of each panel depends both on of ambient humidity and the amount of sunlight. So the more humid it is, the more water we can generate. Some of our panels have been known to make upwards of I think 7 to 8 liters in a day, or roughly 2 gallons in a day, in some of the great humid and sunny areas. I think our global average is closer to around 4 liters a day, or just over a gallon per panel. And again, that's just a single panel over a single day, and those panels can all interconnect to each other and scale to meet the demand of drinking water as needed for the location. And isolate arsenic. So you are all probably much more scientifically inclined than I am. But as I've been told, is that at a high level, if it would require a lot more energy input to convert particles in the air into liquid form into the water. So it does not kind of bring in any of those from the air process into the water process. The water that's collected. And but if you have more interest, I'm happy to follow up and get in touch with our water quality team for probably more scientific answers there. And then recommended for water scarcity with salinity. We have a number of projects that are along coastlines, next to oceans and saltwater bodies that have been operating well. And we have special materials to prevent the outside from rust, and that kind of thing. So it has been very operational and performed well in those environments.
Great, thank you so much, Colin. We have a hand raised from Mohammed Golam Muqtadir. Mohammed, can you hear us? Mohammed? You're on mute. Okay, now we see you're off mute. Mohammed, go ahead with your question. Okay, so while we wait for Mohammed to come back on the microphone, we'll move to a question for Adam. What are the input water quality requirements for the system? The comment is that this has been a limitation of other similar systems, for example, antenna in the past. as well as what are the requirements for the table salt within your system?
Yeah, thanks, Molly. So in terms of the water quality, I can answer to a certain degree, but we'll also have to follow up with our colleagues at MSR to give you a more robust answer. What I am able to say is we do recommend that the level of turbidity in the water that's used is reduced as much as possible, so pre-filtering as possible. The device does have its own internal filter within a pickup tube for the brine solution, so it's able to filter out large debris, and that's largely again to protect the integrity of the reaction chamber itself. In terms of minerals and different chemical and physical properties, again, I'll have to refer you to our colleagues at MSR, but I will say that through testing of different water quality in the handful of different countries that we've found, the resulting chlorine output, again, has consistently been within that 1% range. And that's something that's been tried and tested. And similarly with the salt, if, we've tested salt from, again, a number of different countries and locations, and the result is again the same. Now we know that there's different quality salts and there's different mineral additives within that salt, but again, the way that the device is designed and generated, the resulting output has consistently produced that 1%. The mineral additives to the salt may mean that cleaning frequency will have to be done more frequently, but again, it's all dependent on that salt quality. But I can say, in all the locations that the device has been tested, we've used off-the-shelf, local market available table salt, and without any challenges.
Great, thank you so much, Adam. We have one final question here from Robert Williams, and this is for Colin. What characteristics determine flow rate? Also, how many hours of sunlight are required per day for the panels? And can the panels be installed in locations that are below freezing for extended periods?
Thanks. Those are all great questions. So again, the flow rate is determined by both the kind of ambient humidity and the amount of solar flux or solar irradiance. So we have graphs that show the different characteristics. I mean, it can be quite sunny and very dry versus, very humid and not so sunny. So there's a spectrum there that can be more specific answer when that, based on that specific location. But, there's how many hours of sunlight are required per day? I mean, just the more sunlight there is, the more water you can generate. And if there are days of low sunlight, the fact that each hydro panel stores water internally allows kind of for an added level of resilience for you to access, stored water that was created yesterday or the day before, in that bigger tank to get through some of those days of perhaps lower production based on those environmental conditions. In terms of the below freezing point, so just before temperatures drop below freezing, the hydro panel itself clicks into hibernation mode to basically stop processes when water freezes and expands. And then after the temperature rises again above freezing for, I think it's 3 or 4 hours continuously, it automatically clicks itself back on. So these are things that are done by itself. There's no kind of human interaction to turn it off, turn it back on. It does it automatically as it's monitoring the outside temperature. You can see there's a related question from Mira. Right now, a hydro panel can be purchased online for $2,000 US full MSRP. I think our minimum number of orders is 2 panels, which is typically that for our residential, kind of private residential properties is 2 panel basic. And then, we can go up to as many panels as needed, depending on what are the water demands of and supply needs of that specific location. So all great questions.
Great, thank you so much, Colin. And thank you for picking up on that last question, which is really important. for our attendees in terms of understanding the cost and price. So that was really great to get that response from you. Unfortunately, we have come to the end of our webinar for today. So I am going to have to transition over to our wrap up, but I did want to thank Adam Drolet again from PATH, Colin Goddard, as well as Joanna Egan from Zero Mass Water for presenting on their safe water technologies for healthcare facilities. As we've mentioned before, if we did not get to your chat box question or your hand raise, we will do our best to work with our speakers to respond to your questions later and then post them on our website. So just really quickly as a wrap up, if you have ideas for future webinar topics, please submit those via the chat box, or you can email us at wnhcfaction@emory.edu. As I've mentioned before, today's recording, slides, and the summary documents will be available on our website within the at WNHCF at WHCFaction.org. And then just quickly, next month, our webinar will be on global dialogue translating into national action with members from the WHO. And held on Wednesday, June 26th at 9 a.m. And we will hopefully see many, if not more, of you next time. Thank you so much for participating today.